Hero FinCorp presents Young Turks, 14 years.
Good afternoon, ladies and gentlemen. Welcome to TiCon Mumbai 2016. We'll be discussing the emergence of on-demand healthcare. Welcome, panelists. Today, we have a very involved and a curious customer or a patient. The aspirations are fast changing. Customers are growing more aware of their healthcare needs. They demand quick response, less waiting times, and above all, they demand an increase of the healthcare unit nearest to them. Are we ready to cater to this on-demand healthcare? Who would like to go first?
Today the problem is there are two kinds of doctors. One who has no time, other who has no patience.
How many doctors in this room? Please raise your hands. All right, you heard that.
And also there are two kinds of hospitals. There are no beds in good number of hospitals and plenty of them have no patients. So it's very interesting. We don't know whether there is an excess supply or a demand itself. So the big challenge is to make sure all beds are full and all doctors have patients. And technology is the only one probably would link.
Sure.
And that is where the startups are all warring with each other.
Vishal, would you like to add?
Ever since the time the wave of digital health began, the conversation has definitely shifted from infrastructure to more consumer-centric models. And I think India, basically because of its technology prowess and also the fact that, all said and done, we are a hugely connected mobile community today.
Yes.
So riding on top of that, we are probably set for the on-demand healthcare. Having said that, enough number of gaps out there on the clinical side, paraclinical side, but I think this is one way that India will transform its healthcare.
So like you mentioned, there's a serious and conspicuous mismatch between demand and supply of healthcare infrastructure and services. So what's the way forward? Digital? Yes.
For me, customer is not the patient alone. I think for me, the bigger customer is doctor. The demands for both are quite different. The doctor's demands are lots onto science and technology and little bit services. But when it comes to consumer, it is lots on services. So during the discussion, I think I would focus them differently.
Amit, we were discussing this before also that, the consumer or the patient has changed. It's like a know-it-all patient. So how is this affecting doctors? And I think you would like to ask some of them in this room as well.
Who was the doctor here? Ma'am, how would you react to me advising you on what to advise me?
Today's patient is very, very well informed. And I get patients who know about their illness much more than I know. And as regarding to being available and on demand, yes, I think they want you to be on email, they want you to be on WhatsApp, they want you to be on Facebook, they want you to be on LinkedIn, and I'm there on all the platforms.
This demand is far outstripping the supply. The mismatch has created a strong demand for professionally driven specialty home healthcare services. And Vishal, I would like to bring you in here where Medwell offers such services. So can you throw some light on how these services are actually bridging the demand and supply gap?
I think one of the big issues that India faces is around the chronic diseases side. India is the home of chronic diseases. We have a ripple effect of that happening across around chronic diseases.
Yes.
And if you see most hospitals, at least 40% of the readmission rate in hospitals is on account of chronic diseases. So I felt that home health, with a very strong focus on chronic disease management, can be the one which can bridge that gap. Because hospitals don't want to see these patients again and again because they occupy beds. And guess what? Their cost of this care is equivalent to a couple of days of hospitalization. To a cost of 4 months of care is equal to a couple of days of hospitalization, which I think is the way to sort of use the resources right and impact where it is really required.
So we're talking about home healthcare services. Telemedicine is another fast emerging sector. But this digital, on-demand digital healthcare, is this just an urban phenomenon? Because rural India, where there's lack of primary healthcare services, there's lack of infrastructure. So clearly this on-demand healthcare that we're discussing right now it seems to be only an urban India phenomenon. Would you agree with me?
Yeah, I think it's quite urban phenomena because I run labs in tier 3 cities and some tier 4 cities also. the number of home visits which are done compared to people walking in is a lots difference. And that's why I had to scale up the service accordingly. I see one big advantage of providing home visits. Of course, I have a lot of concerns and challenges I faced. Is there is a good compliance. Many a times after the doctor has written the test, patient tend to not do the test. But if something is available on home, they don't feel lazy to go. And I think the kind of satisfaction home service creates is remarkable.
There is a pyramid of economy. You make it into 10 slices. Currently, healthcare is in top 1, 2, 3 slices. Another 10 years, 15 years it would take for the slice 6 to touch it. And the slice 9 might take 2050, 10 might never reach. So it is something like a journey. It doesn't suddenly overnight go to the bottom of the pyramid. And as Neil has said, because there is a competition, every big hospital is opening a rural center to get the patient to their hospital. So is every laboratory. So for us, business and the bottom is prosperity.
Hero FinCorp presents Young Turks 14 Years.